Greetings. I'm Mike Ciarametaro, Vice President of Research with the National Pharmaceutical Council. Today, I'd like to provide you with a high-level overview of the health spending guiding principles. Specifically, I'd like to discuss 1, why there's a need for them. 2nd, what's included in them. And then 3rd and finally, how you can use them. Let's begin by discussing the why. In 2020, health spending grew to $4.1 trillion, or 19.7% of US GDP. There is increasing concern regarding the sustainability of such increases, thus the focus on health spending by policymakers and researchers alike. However, health spending is a complex topic, with lots of incentives and stakeholders intertwined. Navigating this complex web of stakeholders and incentives requires both robust evidence and decision-making. However, significant challenges exist on both of these fronts. Let's begin by discussing some of the evidence challenges. Good evidence, by definition, should be reproducible. What this means is that an independent researcher should be able to recreate results. However, frequently this is not the case. In this chart, I show you 3 different recent studies that examine the reproducibility of publications. What these studies found is that only 40 to 62% of publications are actually reproducible. Now, this problem isn't specific to health spending. It's a broader problem for health science, but it's a specific problem for health spending because there are no set of standards, which is one of the reasons we need the guiding principles. What about decision-making? Health spending is a complicated topic. Complicated topics are typically susceptible to bias when there's not a structured process to make decisions. Let me highlight 2 of the 12 biases listed here. The Dunning-Kruger effect. People tend to overestimate their ability to make good decisions when they know very little about a topic, as often the case with healthcare, as we could all stand to learn something. Confirmation bias. We tend to look for evidence that supports our existing beliefs or biases. This is especially a problem in healthcare given the overlap between healthcare policy and politics. More important than the 12 biases listed here is the fact that we're all, including myself, susceptible to bias, and therefore there's a need for structured decision-making. This is one of the needs that the health spending guiding principles fill. So how do the guiding principles fill these needs? First, let me begin by saying that the health spending guiding principles are aligned with patient-centered care as defined by the Institute of Medicine. Second, the guiding principles really are 2 separate set of principles combined. The first set, the patient-centered guiding principles for evaluating health spending, are focused on evaluating the robustness of evidence. This set of principles is intended to evaluate publications. The second set is the patient-centered guiding principles for healthcare reform to address rising spending. And these are specifically focused on systematically evaluating policy. So how did NPC create these? Let me first begin by saying that these principles were not developed in a vacuum. Instead, they were actually developed using an evidence-based and expert-informed process. As a first step in drafting the principles, we conducted a lit review of established standards, such as those developed by ISPOR, Academies of Science, and CMS. We took this first draft and we reviewed it with experts across the various healthcare segments. This review was done in blinded fashion and included people such as patient groups, payers, both public and private, policy experts, and think tanks. Their feedback was incorporated into a final set of principles. As a final step, we developed case studies to illustrate each of the principles. So what's actually included in these principles? Let me begin with the patient-centered guiding principles for evaluating health spending. There are a total of 8 principles here. And in a nutshell, you could characterize them as good research practices with a patient focus. The guiding principles here fall roughly into 3 buckets. The first bucket really is patient centricity in terms of analyzing the impacts of recommendations for patients and society. The second bucket, and the largest bucket, really focuses on research methods and includes things such as the use of appropriate data, epidemiologic adjustments, and sensitivity analysis. The final group focuses on placing conclusions and recommendations into the appropriate context. What about the second set? Well, the patient-centered guiding principles for reforming healthcare to address rising health spending is really focused on identifying the multifaceted impacts and trade-offs associated with policy. There are a total of 10 principles, and they can be broadly grouped into 3 buckets. The first is patient centricity. Examples include alignment with the triple aim, policy being grounded in patient-centered value, and evaluating the policy impacts on long-term and short-term patient outcomes. The second bucket includes opportunities for improvement, such as reducing low-value care, increasing high-value care, and removing incentives that distort the system. The final bucket is focused on the impacts and trade-offs and includes things such as financing burden, including the resultant disparities and impacts to innovation. These last 2 slides provide the high-level guiding principles. There's actually a lot more detail in the principle document, which I want to highlight next. So here within the principle document, there's 3 important additional pieces of information. For each principle, we've outlined a lot of additional context and detail defining that principle. This also includes pertinent citations. Next, we have instructions on how to use the guiding principle, providing additional context in terms of how you should perform your evaluation. The final set focuses on illustrative example. What we've done is we've pulled research or policy examples and we've evaluated them. This includes criteria that you can use to do your own evaluations. All of these materials are available on the MPC website. Want to highlight one additional resource that's available, and that's an evaluation by MPC of a West Health policy paper titled, "Will Reducing Drug Prices Slow Innovation?" In this assessment, we use the guiding principles for evaluating health spending. This is a complete example and template that you can use to conduct your own analysis. Second, it also highlights one of the main points from this set of guiding principles, and that's the need to keep conclusions and recommendations within the context of your results. To summarize today, health spending provides opportunity and challenges for both policymakers and researchers. However, there are significant evidence and cognitive bias challenges that stand in the way of creating good policy. To help address these challenges, MPC created the health spending guiding principles, which are a tool to evaluate evidence for robustness and to systematically evaluate policy options. Thank you.